this video, we look at the goals for each of the 8 phases of EMDR therapy through a checklist. Are you an EMDR trained therapist that works with children and adolescents, and you want to make sure that you don't forget about anything important along the way of the therapeutic process? Hi, I'm Jackie Flynn. I'm an EMDR-approved consultant, a registered play therapist, and the creator of 8 Phases of EMDR with Children and Adolescents Integrating Play Therapy Techniques course. It is important to know that the integration of EMDR and play therapy has immense healing capacity. It's a robust combination of therapies indeed, especially when working with children and adolescents. To ethically and safely deliver EMDR and/or play therapy, training, supervision, and consultation are necessary. For this reason, this video is only intended for EMDR trained therapists. Do not perform EMDR therapy if you're not professionally trained. The goals of each phase of EMDR that I mentioned throughout this video have been derived from the EMDR definition. Now let's take a look at Phase 1, history taking. In Phase 1, we use professional judgment to determine if EMDR is suitable for our clients. We also determine if it's good timing for the therapy. We explore any potential targets from negative events, and we prepare a treatment plan to include past, present, and future issues. We identify positive and adaptive aspects of the client's life, and we assess if the client has adequate affect regulation skills and resources to remain stable. And last but not least, in Phase 1, we explore any secondary gain issues. Here are some images that I've taken from my training. This is what Phase 1 may look like with children and adolescents. Well, let's look at Phase 2, preparation. In Phase 2, we want to discuss the framework of EMDR for informed consent with the parent and the client if appropriate. We also want to ensure the therapeutic relationship is sufficient for the client's emotional safety, and we want to assess and support the client's ability to engage in self-soothing and affect regulation. We want to assess and support adequate adaptive resources, as well as assess and support adequate affect regulation skills for development of positive and adaptive memory networks to expand the client's window of tolerance, and development of capacity for relationship. You can do all of this through the integration of play therapy techniques with kids. It's really cool how it works. Here are some images from my training. I have a couple of my books there, and there's the virtual thumb ball for those virtual EMDR sessions with kids. Okay, so let's look at Phase 3, assessment. In Phase 3, we identify the components of the target issue and we establish a baseline response. We direct the client to select an image or other sensory experience to represent it, and we identify the negative cognition associated with the identified target issue, as well as identify the positive cognition associated with the identified target issue. And then we ask the client to rate it on that 0 to 7 VOC, validity of cognition scale. We support the client with identifying any associated emotions, and then we ask the client to pair the image and the negative belief and then rate the level of disturbance while locating the physical location of disturbance in their body. Where is that activation at? Here are some images from my training Phase 3. You'll see some of the handouts and some applications in the sand tray, virtual and in person. Okay, so let's look at Phase 4, desensitization. Phase 4, we activate the memory or the issue. We ask the client to notice his or her experiences while alternating the bilateral stimulation, the BLS. There's so many creative ways to do this with children. We instruct the client to report observations, any new insights, associations, information, and emotional, sensory, somatic, or behavioral shifts. And we also use specific procedures and interweaves if processing is blocked. But we want to make sure we only use them when they're needed. We do not want to overuse these cognitive interweaves. Continue until the SUD, that subjective unit of distress level, is reduced to a 0 or an ecologically valid rating. We also assist the client in maintaining an appropriate level of arousal and affect tolerance throughout the process. Here are some images from my training. This represents some creative ways to do the bilateral stimulation. Phase 5, installation. In Phase 5, we check for a potential new positive belief related to the target memory. We also support the client in selecting a new belief or accessing the previously established positive cognition because it may have changed. We also direct the client to hold the positive cognition in mind along with that target memory and to rate the selected positive belief on that validity of cognition scale, the VOC scale, on a scale of 1 to 7. And here are some images of what Phase 5 may look like with kids. Okay, so Phase 6, body scan. In Phase 6, we direct the client to hold in mind both the target event and the positive belief, and then to mentally scan the body. Then we identify any positive or negative body sensations and continue that bilateral stimulation, the BLS, when these body sensations are present until the client reports only neutral or positive sensations. And here are a couple images from my training, some kid-friendly body scans and ways to support that somatic awareness in children. Okay, Phase 7, closure. In Phase 7, we use techniques to orient the client fully to the present and facilitate stability at the completion of the session and between sessions. Super important there. We also inform the client that processing may continue after the session. We provide instructions for maintaining stability, and we ask the client to observe and log any significant observations or new symptoms. Here's what Phase 7 may look like with children and adolescents. Okay, so the last phase of EMDR therapy, Phase 8, Reevaluation. In Phase 8, utilizing the EMDR standard 3-pronged protocol, we assess the effects of previous reprocessing of targets, looking for and targeting residual disturbance. This is when they come back in the following sessions. We look for new material that may have emerged. We look for current triggers, anticipated future challenges, and systemic issues. If any residual or new targets are present, then we go back to Phase 3, and then we repeat Phases 3 through 8. Here are some images of what Phase 8 may look like with children and adolescents. So if you would like to learn more, please visit my website, Jackie Flynn Consulting. Reach out to me to let me know what else you need to feel more confident and competent when it comes to using EMDR therapy with kids. I would love to help you through challenging cases and consultation training, or just to provide you with more resources, or just to help you hone your skills so that you can truly experience the magnitude of what EMDR therapy has to offer. I can also support you as you earn your EMDRIA certification and your approved consultant credentials. EMDRIA, EMDR International Association, is a membership organization of mental health professionals dedicated to the highest standards of excellence and integrity of EMDR. Through EMDRIA, clinicians can attain top-notch education, consultation, and they'll learn more about the science of EMDR through literature and research. If you haven't done so yet, be sure to visit www.emdria.org to learn more. To learn more about play therapy, trainings, and research, be sure to visit the Association for Play Therapy at www.a4pt.org. On this website, you'll find lots of great training options, credentialing information, and you'll get lots of great resources and much more. So to learn more from me, you can go to playtherapycommunity.com or you can go to JackieFlynnConsulting.com.